Hi, my name is Peyton Burke, and I'm a University of South Alabama nursing student. And today I'm going to be performing my administration of an enema checkoff. So the first thing that I would do upon entering the patient's room, I would perform hand hygiene, introduce myself to the patient, identify them using two identifiers, as well as identifying any allergies on my MAR. And then I would explain the entire procedure to my patient so that they were aware of what was going to be going on. And then provide for privacy, of course. So after doing all that, I would perform hand hygiene again, don my goggles and my gloves, and lay out all my materials that I need in order to perform this procedure correctly. So the first thing that I'm going to be demonstrating for you today is preparing the soap suds enema. So in order to do this, you need an adult enema bag. And I've already filled it, but you would go ahead and fill it with warm water, saline, 750 to 1,000 milliliters. And then you would go ahead and I'm going to apply the soap to the bag and gently aspirate in order to mix the contents thoroughly. So after you do that, you can go ahead and either lay down or set the enema bag up against a hard surface, or you can hang it up on an IV stand. So I'm going to set mine down, but I would normally have it hanging up on an IV stand so that it could be a little bit easier for the procedure. So next, I am going to need to prime my tubing. In order to do this, I would already have had my my tubing clamped when I was filling the bag so that it didn't run out of the bag. But in order to prime it, I'm going to go ahead and unclamp it and make sure that this saline is going through the tubing. And I just be over a trash can just in case. I'm going to see that it is flowing through, so I'm going to go ahead and clamp it back off. And now we're going to move over to my patient, and I'm going to demonstrate inserting the enema for my patient. So I need to get them in the correct position. To do that, I'm going to raise the bed to a good working height for myself, lower the side rail, and I'm just going to explain to my patient that I need to get them into left lateral Sims position so that the insertion of the enema can be a little bit more comfortable. So if they need help assisting them, getting into that position, I can go ahead and assist them. So we're going to move them into that position, make sure that they're comfortable, and this procedure, it's pretty important to make sure that they are covered as much as possible to maintain their privacy. So I would only uncover the area that I need in order to perform this procedure. So the buttocks area. So now I'm going to hold the tip of the enema tubing in my dominant hand, which is my left hand, and my right hand is going to be used to pull the buttocks apart. So this tubing is pre-lubricated, so we're not going to need to lubricate it. If it wasn't, I could use my non-dominant hand to use a clear water-based lubricant, and I would just lubricate the tip of the tubing before insertion. So I'm going to go ahead and remove the cap from the tubing and explain to my patient I'm just going to touch their hip. So I'm going to softly but firmly just press on their hip, and I'm going to use this hand to pull the buttocks, spread them apart, and I'm going to insert this end of the tubing into the rectum 3 to 4 inches, explaining to the patient just to take slow deep breaths throughout the entire process. If they had hemorrhoids, you could tell the patient to bear down, and that might make the procedure a little bit more comfortable upon insertion. So after inserting this 3 to 4 inches into the rectum, I am going to grab my bag off of the stand and hold it 12 to 18 inches above me. And I'm going to go ahead and unclamp this and allow the enema solution to flow into the patient. And if at any time the patient experiences any cramping or discomfort, I would go ahead and clamp the bag and stop the flow and just tell the patient to breathe deep, slow breaths until the cramping ceases. And that completes my enema administration checkoff.